Nurse discharge of a patient. So when you are trying to prepare your patient to be discharged home, there are various things that you will need to do. Firstly, if we go into the patient who's going home, we're clicking on her name on the Care Compass page. We will open the documents. The two M pages that we will be using to discharge our patient home will be TTO medicines and discharge. If we go into TTO medicines, we can see that our patient has been prescribed 2 medications to take home. If we click on our 2 medications to take home and we go across from discharge medication to this blue tab here that says discharge, it will take us to those medications. You will see the 2 pills next to the medication that has now been prescribed for our patient to take as going home. You're going to click on those, and it will then ask you how will they be dispensed. So if you're going to be dispensing from the ward or if it's a pharmacy supply, then you need to tick which one it's going to be, and you can scroll up and down that list. So to demonstrate this, I'm going to say that the coamoxiclav will be given from pharmacy supply, and I'm going to say that the paracetamol will be given as a TTO pack. And then I'm going to sign. The next page that I will want to be going into will be my discharge page. When you come into your nurse view discharge M page, there will be some red asterisk things that you need to complete. The 2 things that have a green tick next to it means that the doctor has already completed their part. But the first part means that they've done the inpatient discharge summary for you, and that they have also put in a current problem list for this visit. So the 2 things that we need to do is we need to go into our nurse discharge checklist. We want to come over to the little arrow down here and we want to complete the discharge checklist. This is just things that you need to put in. If that are applicable for the patient, you check what is necessary and you sign. You will also be completing this form throughout their visit, so there will be other things that will have been done on here as you're preparing your patient's days before their discharge day. And then I want to go into key discharge information, and within key discharge information, the only one that I wish to fill in is the key discharge details. And on here, I want to select how the method is that the patient's going home. So this is where you would select if they were a patient being discharged home, or if unfortunately the patient had died, you would be selecting it and inputting that information on this form. So my patient today is going home with consent, and they're going to their usual home of residency. And I'm putting in T for today's date, and they're going to be going home in about an hour's time. So I'm going to put an hour. Change the time. And then I'm going to put in my name. Search for myself, find myself, and click. And then I'm going to sign. I then need to go into the inpatient discharge summary. And this will be bringing up this pop-up box, which is the doctor's GP letter they've already done. I want to open the existing one, so I want to continue. And I just want to revise the note, and I press OK. And the reason why nurses have to do this is because of that last form that we filled in to say that they were going home with consent and they were going to the usual house of residence. This one actually pulls through. If I save, press on the save button here, it pulls through all of that information from the ward and where they're going to that you have just filled in that form. And that's why nurses need to come in and do this. Even though the doctors have written this letter, we need to come in and refresh it to pull through that last piece of information that we've just done. And we sign. And I want to go into documents, and I want to just right click into this box, and this will pop out. This gives me my opportunity to print now from here, so I'm able to give a copy to my patient. And once I print from here and have that copy there, it will show me the medication that I have here. And then I'm able to go to the Omnicell to get the paracetamol out of Omnicell that we said would be given as a ward pack, and the coamoxiclav has arrived on the ward from pharmacy for me to be able to give. So because I'm giving my coamoxiclav is coming from pharmacy, I will need to document that I have given that for them. So I go into my toolbar in here. Now this may be across your taskbar here. If it's not across your taskbar here, this could just be my view that I've got set up at the moment. I can go into that little arrow there and I can find my discharge medication. And the comoxiclav is what's came from the ward. So I'm going to say given and I'm going to sign. So before I give the paracetamol, I'm going to close that page down. I have to go back out. So for the ward medication that you give, you come back out to Care Compass. You go into your taskbar and you'll see I have been tasked to do the discharge med supply evaluation. I click on that and I document. And I fill in the questions. Do discharge medication require dispensing from pharmacy? For the paracetamol, so no. Is the pharmacy review needed? No. It's been reviewed. Are the discharge medication ready to give to the patient? They are. They're going home today and now. Hospital transport booked? No. And any other comments I wish to put into there, and I sign. I go back into my patient. Back into my discharge, still in my discharge here. I've completed all my documentation. I've printed off the letter. They've got their medication, and now I wish to discharge this patient home. If I click into discharge, I will get a pop-up box. I complete the questions within this pop-up box. They are discharged with consent, and I have to put in here the consultant's name who is looking after my patient, because they're the ones who have said that this patient can go home. And once I've done that and I press OK, your patient will then be removed from the system. And that's how you discharge a patient.